So next what we're going to evaluate is the sensory system. In general rule, sensory evaluation is not done as part of a normal screening neurologic exam. It's generally done when you have specified abnormalities that you suspect. So if a patient has specific areas where they're complaining of pain or numbness, or if you find an area in the motor exam or during the reflexes that's abnormal, those are the areas you're going to want to focus on. There are a few tenets you need to make sure that you're paying attention to when you're doing these evaluations. You want to make sure that if you find an abnormality that you map it out. Don't just say, okay, it's abnormal there, find out the boundaries of that abnormality. You want to make sure that you compare side to side, so right versus left, and always compare proximally to distally. When we're doing the evaluation, you need to explain it fully to the patient first so they know what it is that they're going to tell you whether they can feel or not. And finally, do the evaluation with the patient's eyes closed. Because again, you want to make sure that the patient is not using visual cues, but only using their sensory system to tell you whether or not the sensation is there. So what we're going to evaluate for now is to demonstrate pain sensation in some specific areas where we know the nerve root for those as a demonstration of the exam. So we're going to start with pain. So for pain response, we want to use a sharp object, but not something that's going to cause injury. So frequently what we'll use is a tongue blade that we've broken to make it kind of sharp and pointy. We want to make sure that you use a new implement on every patient every time. So I'm just going to snap in a twisting motion the tongue blade so that one end is kind of pointy and another side is dull. So what I'm going to do now is demonstrate for the patient what is considered sharp. So with their eyes open so they can see what they're doing. So can I have your hand? And so what I'm going to ask you to do is I'm going to demonstrate for you what sharp is. So this is a sharp sensation and this is a dull sensation. Okay? Mm-hmm. All right. So what I'm going to do now is evaluate a sharp versus dull in 3 locations on the hand. So the first one I'm going to do is the web space between the first and second finger. So I'm going to ask you to close your eyes and let me know where you're feeling it.
In between my thumb and no sharp. Middle finger sharp. Pinky finger sharp.
And do the same thing on the other hand. And let me know where you feel it.
Middle finger. Pinky. In between my thumb and pointer finger.
Alrighty, so you want to make sure that you're doing the same thing on the lower extremity as well. So we're going to, again, check for sharp and dull on both feet. So we'll start here, and I'm just going to ask you to close your eyes again, and let me know if you feel it, and just tell me if it's sharp or dull.
Sharp. 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 Sharp.
You want to make sure that you can also evaluate light touch. We can do it in the same locations, but you do it with a wisp of cotton. So again, if you could open up your eyes for me, I'm going to show you what it is. So this is light touch. Can you feel that? Mm-hmm. All right. And then you would do it in the same locations, testing for light touch. So next we want to be able to test vibratory sense. So in this sensation, we want to be able to test that the patient actually can feel the vibration. So generally what we do is we put the tuning, we use a vibratory tuning fork, which is a 128 hertz tuning fork. You want to use it against a bony prominence. We're going to do both the upper and the lower extremity. When we do this, if we find an abnormality in the distal part, so we're going to start with the toe, then I would move inward and see if they can feel the vibration inward. To make sure that they're truly sensing the vibration, what you would generally do is put the tuning fork on there vibrating and ask them to tell you when the vibration stops. And then you can touch the tuning fork to stop the vibration, and they should be able to tell you that the vibration has stopped. Okay. So what I'm going to do is I'm going to start with your hand. Alrighty? So what I'm going to do is put the tuning fork, again, after I've struck it, against here on your hand. Alright, I'm going to ask you to close your eyes, and then tell me when the vibration stops. Okay? Mm-hmm. Alright. So strike the tuning fork. You feel the vibration?
Mm-hmm.
Tell me when it stops.
No.
Okay. And again, do the same thing in the other hand. You feel the vibration?
Mm-hmm.
Tell me when it stops.
No.
And again, do the same thing in the lower extremity. So we're going to again use the joint of the big toe. Tell me when you can feel the vibration,
No.
and let me know when it stops.
No.
And again, you should be able to do that in both extremities bilaterally. Finally, we want to test for proprioception or position sense. So we generally do this, again, using the thumb and the great toe. And again, we want to be able to see that they can sense the position. So you want to do this with the patient's eyes closed, and you don't want to give them extra cues as to what it is. So I'm going to start with your hand. I'm going to take the thumb. Close your eyes for me. I'm going to grab the thumb on either side, not top and bottom. If I use top and bottom, then they can feel the pressure pushing up below and pushing down from above, and use that as a cue as to which direction it's moving. If I do it from the sides, they won't have that same cue. All right, so this is up, this is down. Can you tell the difference?
Mm-hmm.
All right, so now what I'm going to do is ask you to tell me whether it's up or down, okay?
Okay.
So move the joint a couple of different times.
Up. Up. Down.
Okay, and make sure you do that in both sides so you can see that it's symmetrical. All right, now I'm going to do the same thing in your lower extremities. So I'm going to grab hold of his large toe on either side of the joint. I'm going to move it up and down and have him demonstrate up versus down for me. Okay, so if you could close your eyes. This is up. This is down. Can you tell the difference?
Yeah.
Alrighty. So I'm just gonna, you tell me when it's up or it's down, okay?
Okay.
Keep your eyes closed.
Down. Up. Up.
And then you do the same thing on the other side.